The government says over and over and over again that all these well-controlled epidemiology studies prove vaccines are safe. That's a complete lie. We've analyzed them through Freedom of Information documents. We know that all of these studies the government relies on were deliberately designed to lie to the public about the safety of vaccines. They have no science to back it up. Now, admittedly, the science is not in on the other side of the equation, and we need more science to get to these answers. But this crisis should be driven by a sense of urgency that is just not being kicked in at the federal government level.
I'd like to believe that the National Institutes of Health and the EPA and other government agencies has our best interest in mind. But sometimes I wonder, because our children are getting sick, and they're getting sicker. There's an epidemic of autism, there's epidemics of asthma, there's epidemics of cancers, there's epidemics of juvenile diabetes, and I just don't feel that the government is looking into why our children are getting sicker. They're trying to maintain the status quo.
There are many reports by parents, scientists, and growing numbers of physicians that there's a conflict of interest between the medical doctors and the scientists who mandate vaccine policy and the employment that these scientists and physicians have by the very companies and the governmental bodies that are asking them to make these mandates. Over and over again, the scientists and the physicians deny that they have any conflict of interest, that they're being paid by the government or by the vaccine manufacturers to sit on these committees is not a conflict of interest. Well, it is a conflict of interest, and they keep denying that it's a conflict of interest. The problem is that the public is beholden to blind faith that they are being protected and properly guided by governmental institutions. Growing numbers of parents are learning that they cannot maintain that blind faith anymore, that the one-size-fits-all, across the board, vaccination of every child with every vaccine is no longer as safe or effective as we were taught they were.
It's a very, very tough problem. And because it's a tough problem and because it's a political hot topic, people do not want to deal with it. It's much easier to just walk in the other direction than it is to put the time and effort into trying to solve something that is as complicated as this, particularly when the paradigm has always been there's nothing you can do for these children, that it's a waste of time and money to even be looking at this.
The implications are horrible in terms of if you were a pediatrician and you had essentially gone into that field because, among other things, you wanted to help kids. I mean, how hard must it be to realize that you may have actually done a lot more harm than good?